I'm a practicing vitreoretinal surgeon in Northern California. I practice at Northern California Retina Vitreous Associates.
What did you present here at AAO?
At this year's annual American Academy of Ophthalmology meeting in San Francisco, I had a couple talks today looking at new treatments in neovascular age-related macular degeneration. I presented on 2-year outcomes in a large clinical trial involving a new type of protein therapeutic called abicipar, and we looked at the 2-year results. I also presented some other research looking at outcomes in patients treated with macular degeneration from some previous studies.
Tell me about the new treatment results you presented.
I think when we look at our treatments for neovascular AMD, I think it's first important to acknowledge what's the problem or issue out there. You know, we've had a lot of great treatments with anti-VEGF therapy. We've had great outcomes and clinical trials. Unfortunately, that has not always been replicated when we've looked at the results in the real world. Part of the issue is that often our patients aren't getting treated enough. People talk about a treatment burden, which is challenging for the patients to come in every month or every other month for their treatments. And unfortunately, they often get undertreated and the visual outcomes are not as good as seen in the clinical trials. And so there's some really exciting new things on the horizon which may help our patients with neovascular AMD. The first group of agents that I like to think are similar to the medicines we treat today in that they're intravitreal injections, and the hope is that these medicines can last a little bit longer. Just this week, a new medicine called brolizumab was recently approved by the FDA for the treatment of wet macular degeneration, and it gives the potential to maybe go longer in some patients with neovascular age-related macular degeneration. I presented some data regarding another medicine called abicipar, which has also been shown to go to 12 weeks. And I think it gives us some options there. And so the nice thing is for this group of patients, we now have medicines that are very similar to how we give medicines now, and hopefully we can go every 3 months with them. And having those options that are, brolizumab was just approved, and we'll see where abicipar gets approved, as we'll find out next year, are really on the horizon or are happening right now. The next class of medicines are medicines that can last a bit longer than even 12 weeks, and these involve using a drug delivery device, there's a device called the port delivery system, which has been shown that you can actually have a procedure done and the medicine lasts for maybe up to 6 months. And so here you can see in this class of medicines we're now moving away from the 8 or 12 week option to the 6-month option. The phase 2 data involving the port delivery system was very exciting. 80% of patients did not need a refill at month 6, and the median time to refill is almost 15 months. So you can see with this next option that we can actually go longer, up to 6 months, and so that's another exciting option that we have, and that's something that may be on the horizon the next year or two, as the phase 3 study was just completed, and we eagerly wait to see the results of if that option is viable and is an option we can offer in our clinics. And then finally, the third area is kind of another very exciting area where instead of having treatments that last 8 or 12 weeks or even 6 months, there's a potential to receive a treatment once and have it last for a long time. And that involves gene therapy. The concept behind gene therapy is you can use gene therapy to introduce a gene. So instead of having to get a medicine by an injection in the clinic, the gene therapy delivers the medicine right in the eye. You use the cells in the eye to produce the medicine there. And so there's been some very exciting data and some very early phase 1 studies. These involved various different approaches of gene therapy, either involving a surgery or even giving an injection in the clinic, but the potential is that the medicine may last for a longer period of time. There was an exciting talk at this year's American Academy of Ophthalmology that looked at some early data or early results from a small study that showed that the protein often lasts up to 12 months, and there are some patients who needed many injections before do not need as many injections afterwards. So this is another exciting area of gene therapy. It's still very early. As I mentioned before, these are phase 1 studies, so it's going to take a few years, and if it does all work in the next level, it will be another great option where maybe we can treat our patients even less and give them a better option for their treatment. So I think in summary, we're very fortunate to have a lot of these new treatments. We have a set of treatments that are going to be on the horizon the next year to the next 5 years, and hopefully as more of them work, we'll have better options for our patients.
Since brolizumab is now FDA approved, will it be a treatment option soon?
Correct. So it is. It was just FDA approved, and there's always a process of getting the medicine to our patients. And regarding, there has to be correct billing codes and done the right way. But I do believe it's available now, and it is an option that I think once all the logistics get worked out, we can offer that option to our patients, especially for those who are looking for something that might go longer or might work better than the medicines they're currently getting.
Is the port delivery system trial complete, or is it still ongoing?
The port delivery system, just the results that I quoted before was from the phase 2 study. The phase 3 clinical trial was just completed this year, or it was the last patient was enrolled. So we'll have to wait about a year or two before those results come out, and we eagerly wait to see if the great results in the phase 2 study are replicated in the phase 3.
Are they using a current pharmaceutical for the trial, or are they using a new drug?
So they are using ranibizumab, which is a medicine we use now, or it's commonly referred to as Lucentis. Currently, we give Lucentis as an injection. With this medicine is loaded into this delivery device and is given, gives it constantly. And it does require going to the operating room to have the implant placed in. But the nice thing is that once it's placed in the eye, you can refill it from the office, and you don't. And so that's a really nice option. We could offer our patients.
Where can a patient find more information about these trials or possibly participate in an ongoing trial?
So I think there's a lot of great options. I think in your area, I think it's always a good option to go to clinicaltrials.gov, and that gives you all the clinical trials that are out there. For our area, we do a lot of clinical research, and so you can come to our website at www.ncrva.com to see what studies are there. But you'd have to be in the Bay Area for that. But I think clinicaltrials.gov is a good resource to see what studies are available, and then what are the sites maybe in your neighborhood that you could be a part of.
Thank you for sharing this valuable information.